My name is Marianne Byerwalter, and I have the pleasure of introducing today's session on sports-related head injuries. Dr. Gary Steinberg has served as the former team neurosurgeon to the San Francisco 49ers. He is joined today by well-known NFL quarterback, Hall of Famer, and past Super Bowl MVP Steve Young. We have a lot of titles and honors on this stage here with these two, and among the many titles, Dr. Steinberg holds the Bernard and Ronnie LaCroute William Randolph Hearst Endowed Chair of Neurosurgery and Neurosciences. He is also the founder and co-director of the Stanford Stroke Center. And if that's not enough, something you might not know about Dr. Steinberg is that prior to attending medical school, he studied classical trumpet on a music scholarship in Switzerland. Pretty impressive. Apart from his many athletic achievements, Steve Young has dedicated his time to making an impact on children's lives. In 1993, Steve founded the Forever Young Foundation, a nonprofit organization that serves children facing significant physical, emotional, and financial challenges. Steve has also been very involved here at Stanford Medicine as a member of the Stanford Hospital Board of Directors, where I had the pleasure of serving with him for 10 years. Steve was a very valued and highly dedicated member of our Board of Directors. In addition to volunteering at Stanford Hospital, Steve has been a key contributor to Stanford University's Entrepreneurship Corner, sharing his knowledge on many topics, such as negotiations and accountability. So please join me in warm welcome for Gary Steinberg, Dr. Gary Steinberg, and Steve Young. Okay, gentlemen.
Thanks, Marianne. Gary, do you want to say anything before I start, or you're the guru here, so I don't know if I want to.
I'm going to welcome everyone, but I'm going to have Steve lead off here.
Well, so Gary and I have known each other since the mid-'90s, and we were introduced under very tough circumstances. I'll call it a series of concussions. There's 3 or 4 through 94 through 99, so 5-year period. And I want you to know that none of them were lumped together by weeks. You know, there was a big spread amongst them. And at the time, football was going through a real transformation, a positive transformation. And it was being led in many ways by the 49ers, because the 49ers with Bill Walsh had led a number of big changes in football, from hydration to travel to just holistically looking at the athletes, treating them like human beings. This is all a new concept. The 49ers had led the way even since 1980 when Bill Walsh came. So Bill was the one that, and so at the time, concussions were becoming used to, before that, and Gary will remember this, you had a concussion, it was a joke. You know, you walk around kind of dizzy and everyone's like, oh, look at Bill, he can't even walk, and it was not, it was tragic. And I look back at the time my dad talks about when he played in the 1950s, and it was just horrific, the things that people thought of when they thought about concussions. Well, it was transforming, and I was in the middle of that transformation where people were getting really serious about it. And part of that was engaging experts in the brain, because now you're talking about something, when you hurt your knee, I could have anyone come out who has a hurt knee and you'd say, he's not ready. Because you can see, you can't walk or you can't run or you can't fake that. But a brain injury was just nefarious. You weren't sure. Even as the person who had it, I was like, I think I'm okay. Feel pretty good. Am I all right? And that's when I got engaged with Dr. Steinberg, and he said, the 49ers sent me over to Stanford as the ultimate expert in kind of head injuries and brain trauma and everything else. And Gary ran me through a battery of tests, and we started doing baseline testing and a lot of different things that helped me start to understand if I was healthy or not, and give me more confidence about that. And I really appreciate that through the time. I think that at the time that it was the seriousness of the injury was transforming. It was transforming in football and a number of the sports, in soccer and hockey, and really just anywhere that kids were having injuries. It wasn't necessarily. I mean, I've been stopped innumerable times in the last 15 years yesterday at school, over at my son's school, a mother came to me and said, hey, my son, he was diving for a ball and he got hit right in the temple and he didn't black out, but she gave me all the details around the event, and she said, what should I do? Well, that's the problem, is that now people look at me like, oh, he'll know what to do. And what I'm grateful for is for Gary and his real work at this to create a functioning now. And is it announced, Gary, what you're doing with here at Stanford, where you have a traumatic event with your son or daughter, and it's or mild or adult or whatever, and you're not sure, you can go into his what's the official word? Brain trauma?
It's a concussion and brain injury center where we're going to be available 24/7. And if you have a sports injury, you'll be able to call us, see someone immediately, and then have a very sophisticated evaluation.
Well, that's a great thing. It really is. And honestly, I could stop talking now, because that's what the resources that people really need, right? It's just, I need to know. And she was wondering, he wants to play football. And he starts this fall in ninth grade, and what can he play? And I said, well, do you like football? As a game? She goes, well, kind of. I was joking with her, because I don't know what else to say. I don't know how much expertise I give, but I can give you my own experience. My own experience is that the brain, and Gary, stop me if I'm wrong, but it can sustain mild injuries and recover and heal. And I have high confidence in that. But over time, like any muscle or any other part of the body, constantly doing that process, it builds scar tissue. And is it scar tissue that I actually talk about, Gary, or something like that? And it just becomes something that is a problem over time. So you have length of issues, and you have numbers of issues, and then you have severity. So those are kind of the big things. And so when I talk to people, I just say, how many, how much, and how often, And so, and to me, if they're mild, mine were always what I call vanilla, which means that I was dizzy, I didn't feel great that night, I woke up, I was tired for a couple of days, I had no other symptoms, sensitivity, memory, taste, the number of things, the horrible things, depression, other things that people have had through my experience. Now people come to me and they're like, my son is suffering, and I'm like, oh my gosh, get him to the hospital, this is a disaster. They're, oh really, I didn't know. So I was always somebody that was, even the numbers became the problem, not the severity and not the frequency, but the numbers became a kind of an issue. It's like, look, I think it gets to be something that, and it doesn't get better. It's not like it gets easier to, my experience is it gets easier to have them happen. And so now I'm 38 years old. I've played for 17 years professionally. And Gary says, hey, you're healthy, but it's happened a lot, and it's happening more frequently. What do you think? And I was like, that was when I retired that next spring. Multiple issues. I could have told Gary, hey Gary, thanks for the opinion, super job, appreciate you. I'm off to play. Because it's my life, I can choose that. But I think that between the two of us, and Gary will tell you, with multiple inputs at the time, and at the time that I was going through this in 1999, in the fall, I would go to the grocery store, and I'd have some elderly woman say, Steve, we love you. We think that, please don't play anymore, please. I'm like, after a while, it became very evident to me that I was invested in the Bay Area and the 49er fans and the faithful. We were invested together. And in many ways, part of my decision to not play anymore was directly attributable to people saying that kind of thing. I'm not disrespecting that emotion to say, oh, I'm fine. Because then I would say, oh, I'm fine. I can go play. And then deep in behind there, they wouldn't say, like, And I didn't want to spend the next 50 years people saying, he did it. So all that combined together, and then my dad finally said in the spring of that 2000, before I retired, when I was making the decision, he said, Steve, 17 years you played. Yep, Dad, 17 years. So is it 18? Is that the key? Is that the number that is that the one you're reaching for? I'm like, no, not really. I never had a number in mind. And so I retired that June. And I told Gary, despite the fundamental parts of it that were the health and wellness but there's also the political parts of it that we were all dealing with, because the media had its own opinions about what was healthy and what not, what the football should do about it, and what doctors should do about it, and what players should do about it. And so all this was rolled into quite a crescendo, because soon after that, the league got more involved. They got more protocols for what happens. Now today in the league, there's things and now Gary's going to talk about a pair of glasses on the field you can put on. It tests your eye movements, and you don't have to ask the guy, who's president, or where are you, or, because in the old days, we would tell each other what the questions were going to be, and then you'd whisper to him, Abraham Lincoln, because that was the way to. But now, you think about that, what a powerful tool that is for a doctor. Put the glasses on, test your eye movement, and now they know, no, that's you're sitting down. And that starts a whole protocol. Once they say you're injured, starts a whole protocol, which I think makes things much safer. In the end, athletics is risky, like life, like anything else. Getting in a car, walking down the stairs, there's risks that we take. And so, but I think the most important thing, and Gary, thank you for all you and many like you that are making it so that we can reasonably fairly discuss assumption of the risk. So we can say, because there's bill writers, there's astronauts, there's a lot of people that say, I see the risk and I'm in. And we say in America, that's fair. But if you don't understand the risk and you say I'm in, then it's not right. Something's amiss. And so for head injuries for a long time, and even now, the brain, and I don't know, Gary, I don't know how you even study the brain because it's such a mystery, but we're getting to a point where I think we can reasonably tell people, here's the assumption of the risk. And that's all parents and anyone else really want. They can make good decisions. They can make fair decisions, but they just need the information. And so I am here to say I'm the vanilla concussion guy. I knock on some wood or anything else. I've been 100% since I left Gary's office in 1999. And I've got great baseline tests as I get older. And, my wife twice has demanded retests.
Inspiring.
Because she says you're getting forgetful and you're not focused. And it's been difficult, Gary, because I tell her, and that's been the worst results of the test is, Mrs. Young, it's good news and bad news. The good news is he's fine. The bad news is he's fine, right? So good luck to you. It might be genetic. It might be related to the species. I don't know. We'll see. But I appreciate the chance to come. Howie Pearson here is one of the development officers and great leaders in Stanford, and he's a good friend of mine, and he's here, and I said, Gary, Howie, this is my goal. Marianne knows this goal as well. I want to do so much on Stanford campus and help as much as I possibly can, because I live locally, that over the whole kind of course of many, many years, that you'll think I went to Stanford. Okay? That's my goal. All right. Good.
So I think Steve put it, in fact, he summarized what I was going to say. So
sorry,
just
Gary, I didn't know.
Questions? So I'll say a few things about concussion and my experience. Marianne alluded to this, and Steve's too modest to really tell you what his career was like. Steve is one of the greatest NFL players of all time. He set many records, passing records, rushing records, MVP for a couple of years. He had a super season the year that they won the Super Bowl in 1994, was the MVP then. He had 6 touchdown passes, So we're sitting here with a real icon. And in 1996, as Steve alluded to, when he was 35, he had 2 mild concussions, no loss of consciousness, symptoms cleared quickly. He played the next week. I was not involved at this time. The first game of the 97 season, he had a mild concussion, was just stunned, went back into play. And then the team got me involved, and I became the 49ers neurosurgeon for the next decade. And
That was your first 49er, right?
exactly.
Okay. I'm proud,
You
proud
were
about that
you were
part
the
of
first
that.
one. We treated subsequently other players. And I cleared him to go back. And then the next season, no concussions. In 1999, he had another concussion, and this was a little more severe because he lost consciousness briefly and had a little amnesia. But then he recovered completely, neurologically normal, MR scan, which is sensitive, normal. I advised he take off 2 weeks, and he recovered, and he wanted to go back and play. And this was a tough decision. So for me, what do you consider? You consider Steve as a patient and as a person, but you also have to consider him as a professional athlete. I mean, this is his career. And what are you going to advise for this year and for subsequent years? You know, what if someone said to me, you can't practice neurosurgery anymore? I mean, this is my career. And then you have to consider him as a celebrity. And what about his family? I remember Steve telling me, and I'm glad your father changed his opinion, because initially his father said, hey, Steve, I played football. Yeah, you get dinged, but what are you, a wuss? Get back in there. I mean,
My dad's name is Grit.
yeah. And, you know, this is how, right. And this is how football has evolved, right? And then what about the football organization? I was getting calls literally several times a day from Bill Walsh, from Lee Steinberg, Steve's agent, from the press. How do you deal with all that? So this was not a simple decision, and it's a different decision than you make for a high school athlete in a lot of ways. So we struggled with this. You know, should Steve play? Steve's a smart guy. He has a law degree from Brigham Young University. And I decided, there was a lot of pressure on me to let him play.
It was really unfair, to be honest with you. It wasn't right.
Yeah.
Because the nature of how it was coming down, the league hadn't had protocols. They hadn't formalized all the things that they were going to do. And in some ways, Gary, it was like, okay, go see Gary. It's too hot.
They didn't want to make the
Yeah,
decision.
so go see Gary. And so here's Gary. He's got to practice. He's like, I don't, I'll see you as a patient, but I don't want to take on all this other stuff. And so that's why I think time now has gone on to give stability in all those arenas, so nobody feels the pressure points, the unrighteous pressure points of dealing with this issue. So I appreciate his forbearance, even taking it on at a time which I thought was really kind of not
Plus,
right.
we had to sneak him into the clinic because he'd come in. People say, that's Steve, that's Steve. I'm going to sit down, back. So what do you advise for this year, future years? What are the risks in returning to play? What's known about the pathophysiology of concussion? What are the long-term sequelae and consequences of a single or multiple concussions? And back in 1997, we knew even less than we know today. We knew very little. I researched the subject, and there were very few good studies to base your recommendations on. What is a concussion? It's the Latin for violent shaking of the brain, and what happens is, as you can see in the diagram of the helmet and the brain, there's a blow to the front, the brain goes backwards as a result of the blow, and then it hits, because the brain moves around, it hits the back of the skull, bounces around, and that causes injury of varying degrees, basically. So it has to do with both rotational or angular acceleration and linear acceleration. What are the signs and symptoms? And these can occur after the injury and resolve, or they can remain as a post-traumatic syndrome. It can be cognitive problems, confusion, some amnesia. You don't have to have loss of consciousness to constitute a concussion. Feel in a fog, not feel right. You can have headaches, fatigue, disequilibrium, double vision. Visual symptoms are common. Emotional ability, or problems with sleep in terms of your sleep-wake cycles. It's the most common form of athletic injury. There are about 250,000 football concussions a year. High incidence, as you might expect, in hockey and soccer. And interestingly, football players with a history of concussion during the previous 5 years have a 6-time increased risk for incurring another concussion. Not surprisingly, boxing has the highest incidence, where the idea is to concuss and knock someone out and cause brain injury, at least temporary. Usually, concussions resolve. You all know that. Some are serious with long-term consequences. And you've probably heard about the increased awareness after several professional football players and hockey players have retired, and then 4,000 NFL players recently sued the league. There was a settlement of almost $600 million, which is still being disputed. So it's in the public now. I have to give credit to the league, as Steve was saying. The NFL has been very proactive. They've worked with neurosurgeons to institute new guidelines for return to play. Now there's a sideline assessment protocol that began rapidly that's compared with a baseline, although football players are smart. They sometimes perform intentionally poorly on the baseline exam so that when they're examined on the sideline after a hit, they're not going to have a subnormal performance. Changes to the playing rules. So there's been an expansion of the unnecessary roughness rules. When a receiver catches a pass, if a defense player hits in the head or neck, it's a penalty. And if a helmet comes off completely, the play is stopped. And there have been some other rules. So that's a positive move forward. A lot of education, advocacy, and I'll show you some research on testing of equipment. The NFL has invested heavily in trying to research the long-term effects of concussions. And now there has to be an unbiased neurologist or neurosurgeon at each NFL game, not affiliated with the team, to assess the players for concussion. Now, what are the signs if you're in a game? And this applies to high school students also. Players can appear dazed or have a confusion about the assignment, disorientation about simple things like the score, inappropriate emotional reaction. Sometimes there's clumsiness or incoordination you wouldn't expect, or players slow to answer questions. You don't have to have loss of consciousness, but if you have that, there's no doubt there's a concussion, and any change in personality. Up to 3.8 million concussions occur a year recreationally in the U.S. At least 100,000 are in your kids in high school. And here's some interesting statistics. So football, not surprisingly, but look at the incidence. Girls soccer is higher than boys soccer. Girls basketball is up there. And I've seen a number of actually Stanford female basketball players who have had concussions. This I found a year and a half ago in the New York Times, and this really shocked me. This was a Pop Warner football game on the East Coast. These are pre-adolescent boys, less than 120 pounds, and the teams were so lopsided that the score after the first quarter was 28-0. You think they would have stopped the game. 3 concussions occurred. They pulled players on the losing side in the first quarter. No officials intervened. The final score was 52-0. 5 concussions, the last one on the final play, and even with the mercy rules, people were appalled that the game wasn't stopped. So this should not happen, and fortunately, it rarely happens now. If you've had a prior concussion, it increases the risk for a subsequent concussion, and a prior history of concussion can delay recovery. If you play while you're concussed, there is evidence that that may delay recovery and in some cases cause some serious permanent problems. Now here's some interesting data on the genetics of it, and this is emerging information. A certain gene, ApoE4, is known to increase the risk of Alzheimer's disease. And we've known that for a number of years. More recently, we found that having this gene, and you're born with this gene, you can't manipulate it, you can't change it. If you have that gene, it predicts a poorer outcome after head injury. Several studies have shown that. And if you have the presence of that gene and a previous head injury, you have 2 to 10 times risk of developing Alzheimer's later in life, 2 studies have shown. Boxers with 12 or more professional bouts and the presence of this gene have an increased risk of developing this chronic traumatic encephalopathy, which I'll mention briefly, which is a pathological condition, a result of multiple hits to the head. Now, what about student athletes? This is relevant to all of you. student athletes in high school are under a lot of pressure to perform, not just on the field, but in school. And many of them, because they're so talented, participate in multiple sports. And there is really a lack of resources. We talked about this for evaluation. That's why, as I'll mention, the Stanford Concussion Center is now being developed. We just founded it to provide that kind of professional help for all of the community, as well as for professional athletes, NFL, professional hockey, soccer, NCAA teams, in addition to the community. And oftentimes these symptoms are just, as Steve mentioned, are dismissed as normal. I felt dinged, but no big deal. These are the symptoms you can have as a short-term sequela: problems with memory, problem solving, difficulty with language, expressing oneself or understanding difficult concepts, personality alterations, sleep disturbances, mood changes. Headaches are very common as part of this post-traumatic syndrome. Dizziness, just not feeling right. It usually resolves in a few weeks, within a month or so. Occasionally lasts longer, but it has led to the retirement of several professional hockey players and football players. Now, there's an interesting syndrome. It's very rare, so I don't want you to get too worried about it with your kids. But this was described by a neurosurgeon at University of Michigan in 1973. 2 football players at University of Michigan with prior concussion syndromes subsequently died after a relatively minor impact. It's called a second impact syndrome, and it occurs, been described very rarely in football, boxing, and hockey. Usually it's a mild concussion, but there are ongoing symptoms, and patients or athletes were sent back into play too early. And this was back in the 70s, before we knew what we know now. And there was rapid deterioration, death. Probably what happens is the brain hasn't recovered, the blood flow that is very tightly regulated lost its autoregulation, and there was increased blood flow and swelling in the brain when the patient went back in, and then a second hit caused marked expansion and swelling that led to a very severe injury. There's really a lack of rigorous scientific evidence. We have more evidence now than we had in the past, but there still is surprisingly little evidence. There's some circumstantial evidence that post-traumatic syndrome can be prolonged as a result of multiple concussions, can last even years. And I've seen even high school and college players who have had that. And very rarely in athletes who have been autopsied, and this comes from really about a dozen NFL players. So it's a very small subset out of probably 400 NFL players now who have subsequently died of various causes, some natural. 12 had autopsies, and what was found was this pathological condition where there's a buildup of this protein, tau protein, which is also the protein that builds up in the brain in Alzheimer's disease, in these neurofibrillary tangles, actually. But this chronic traumatic encephalopathy, which is known to be prevalent in boxers, I mean, Muhammad Ali certainly had that and led to problems including Parkinson's, can cause motor, cognitive, and psychiatric symptoms. We think it's extremely rare, but that's one of the things we worry about with multiple concussions in athletes. So, as I mentioned, we just recruited Jam Gajar, an internationally recognized expert on concussion. We recruited him from Cornell. He founded the Brain Trauma Foundation, an international foundation. Now he's at Stanford. He came a few months ago. We have founded the Stanford Concussion and Traumatic Brain Injury Center. It's going to be a national center for athletes, veterans, and the community, providing comprehensive care, sports medicine rehabilitation, and state-of-the-art technology I'll mention a little bit of, and we want it to be 24/7 availability for all of you. Currently, it's difficult to define a concussion. There's not a good diagnostic objective test. It's often undiagnosed. Athletes deny symptoms. In the past, it's required lengthy cognitive neurological evaluations to look at alertness, balance, memory reaction times. MR scans are getting better. We now have new sequences we've developed at Stanford that seem to be more sensitive. We're still trying to determine how they predict long-term sequela or what they mean, but we're getting better at that. It's usually treated with rest, as I say, and 80% of patients recover within 3 months, but the 700,000 a year in the US who don't recover are the patients we're trying to investigate. So what gets disrupted after a concussion? It turns out that attention is the most sensitive parameter in the brain. And how do you measure attention? The most sensitive way of measuring it, it turns out, seems to be eye tracking. And Dr. Gajar developed an eye tracking system, which, by the way, you'll be able to trial out in the tent. We have it set up for you, and it takes about 30 seconds to a minute to do and to report the results. Because eye movement is one of the most precise and well-controlled functions in the brain. And you can imagine why. It's very adaptive for you to be able to track movement in the primitive world and actually in the current world. It's very reliable, and there's a portable system you can bring to the field. It takes about 30 seconds, and let me show you what it looks like. So hang on a second, let me go back one slide, because you can see on the left there's a goggles that you look into, and then there's a computer system that displays it and analyzes it. So start the video, and you can see here's a normal person tracking the red dot with both eyes, left and right. Very accurate tracking, very fast. And now you're going to see what happens after a concussion in a patient. This is 1 week after a concussion, and look how the eyes can't quite track so easily. So attention is being disrupted. And this seems to be better than any of the cognitive tests, the balance test, and it's quick and easy. And then 4 months later, recovery. So go try it and see what you think about it. Don't get distracted. So, and there's improvement in technology. So the Rydell football helmet now is being trialed with gyroscope accelerometers in the helmet, which can detect the forces that are transmitted with blows to the head. Reebok has a mechanism that they're trying in hockey players. You can see it on the upper right. And it displays green light flashing if there's no hit. If the yellow light flashes, there's been a moderate concussive force. And if the red light flashes, there's been a significant injury or force to the head. What that means, we're still trying to figure out. That's being used in hockey players. Perhaps the best device is what's being used in the Stanford football players, and that is in the mouthpiece is implanted a gyroscope and accelerometer, and that may be the most accurate for detecting the forces that are transmitted to the brain rather than implanted in the helmet, because that's actually in the skull itself. And the NFL has developed sideline tools which can be compared to baseline, and they can be done now within about 5 to 8 minutes, so very rapid. These are being implemented in some high school sports, actually. And a question I'm always asked is, when can a player, say a high school player, return? So there are new guidelines that are being instituted nationally. If someone has a concussion, those symptoms I mentioned to you, even without loss of consciousness, or there's even a doubt about it in a high school player, they come out. They don't play, they don't return to the game that day. That's an absolute. No activity, either physical or serious cognitive activity, probably for 48 hours. Now, this is a little bit individualized, and people have some different opinions, but I'll tell you what I do. So usually the game's on a weekend, there's no school. Depending on symptoms, if they still have symptoms by Monday, I wouldn't send them back to school. If they still have headaches or not feeling right, because you want to rest the brain. Now there's a controversy a little bit about complete brain rest, and I don't usually put the athletes in a quiet room and don't let them do anything. They get bored, and I think it's counterproductive. So once they are back to feeling okay, no symptoms, then they go back to school. And in fact, it's often send them back to school half-time, or start them reading 20 or 30 minutes if they're not getting headaches. Video games, probably not a good idea. After they're back in school, they're okay. Start some light aerobic exercise, and that can be the next week. They're probably going to miss a week of playing. That's usually what happens, because it's a graduated return to play. So first, just some simple exercises to increase heart rate, then more sport-specific running drills, add some movement. Finally, some non-contact training drills, running, more progressive resistance training, and that's to regain coordination and the cognitive load. And then finally, full contact practice after medical clearance, and this is important, restore confidence, assess functional skills, return to play, finally, and prevent another injury. And I should say that high school sports now, 3 things are very important. One, they come out of the game if they had a concussion or there's doubt about a concussion. They do not return to play. Secondly, immediate evaluation by a professional who is experienced in evaluating concussions. And finally, they are not cleared to return to play except by a health professional who, again, is very experienced in concussions. And that's where we think our concussion center is going to be very, very valuable to you. So Steve Young now is a successful ESPN sports analyst, entrepreneur, philanthropist, father of 4, husband.
That's why I'm texting. I got a boy at a baseball game with no ride, so.
And
Mom's wondering what happened.
So all those years ago when we were deciding.
I didn't forget.
And I should tell you, when I said, Steve, I think you need to retire, and I said, you go get some other opinions, and he did. He got at least 2 other opinions.
I think I got
or 3 other
professional opinions. I got at least a handful.
Yeah, he got I think
But
3
I
other
had
opinions.
about 700 opinions.
Yeah. But from other neurosurgeons who deal with concussions, and they, I think, said the same thing. So you decide. Did I make the right recommendation?
Gary, think about it. 18. That's what my dad said. So you've been playing 17 years professional football, and you want to force your way to the 18th year, and it's on the edge, regardless if your body's taking, forget about head injury, just everything. And so it takes a village to get, because when you retire, Gary says it, you're one of the better guys in the world playing this profession, and the fact is the next day you retire, you wake up and you're not good at, I'm going to overstate it, but you're not good at anything else, right? And that's a hard place to be. I'm an expert, one of the world's foremost experts. I'm on anything. So anybody that talks about professional athletes retiring and get over it, it's not easy. Regardless of what else was going on, it's not easy to move on. Because and I've said many times that my life is much more sublime and wonderful than I ever played in football with my family and my other jobs and everything. But I'll never replicate 3rd and 10 down by 4 in Texas Stadium. it just doesn't happen. So what happens is athletes retire and then they chase that feeling. Like, I want to find that feeling. You need to say it is not possible. So Gary, thanks for being a part of the rest of my life.
So I want to conclude. I just wanted to thank Rich Ellenbogen, a neurosurgeon at University of Washington, who's working with the NFL and loaned me some slides, and Jam Gajar, who I say is now on board here, an expert in head injury, and will be opening our concussion center. Actually, it's going to move in a year to our new 92,000 square foot new neuroscience outpatient center, where we're going to have a very patient-directed focus on clinical neuroscience, where we'll have neurosurgeons, neurologists, neuroradiologists, all the diagnostic parameters, tests, rehabilitation in one place so that it's centered around the patients.
And I can't tell you how wonderful that is, because the parents that come see me want the right thing to happen. They want to protect their children, and they don't have the resources to do it. And it makes them feel really lousy. And that's why they're asking me, and they're asking anyone else that will give them an opinion. And now you have a resource center 24/7 to bring your child or adults or anybody else and say, look, this is what's happened, and get some real help. And that's a really neat thing. So thanks to you, Gary.
So thanks for your attention. We're happy to take questions right now. Questions? We're developing it now, but we'll put it online. We'll give you a number to call. Nick, you're in the back. Start taking notes because this is what the community wants. Yeah, we want to make it very, very available to you.
There's some good apps that others have done that I think are decent resources to have on your own, to your point, online.
Yeah,
so
we
you
can
want
give
to
you
look at
those.
those too. There's developed by some other people that I think are very good.
Yeah, we'll have it online because we want it to be, as I say, a national resource.
Oh, well, the question I had is, with soccer, the women, I was a little surprised the women had more concussions than the men. Is that because of heading or they head the ball more?
That's a great question. Heading is part of it. That's not the only way that you get a concussion in soccer. And it's being looked at now, how much the heading itself. But it's due to other injuries. I mean, getting kicked in the head and,
Oh, for women? Okay.
Soccer's women play pretty aggressively.
Okay.
Well, that's what's interesting.
I saw my daughter playing soccer. And they were,
and my wife, who wasn't a competitive athlete, has had more concussions than me.
Oh.
Fell in the grocery store when she was little. Fell skiing, and had a number of, and so these are not just athletics, this is just life,
And are other martial arts like equivalent to boxing, like judo? And,
we don't know the answer, but if there's blows to the head, you might expect they are. Boxing's going to be the worst because, that's the intent.
Okay, thank
You're
you.
talking about the head injuries. Is this on?
Where-
Okay.
Who's speaking?
And
Oh, there she is.
when I used to go to the optometrist, they have, which reminds me of your helmet thing, a test where you push a button and they've got a bunch of lights going around. Would that help with diagnosing concussion also?
It might if it's been validated. I mean, this test has been validated and there have been studies using it. So, it simulates what the eye tracking is doing. But probably it's better to have a test that's been developed by the experts.
Real quick question. Stanford's a private institution, and I know there's been a lot of awareness on the effect of concussions and brain injuries from the veterans that are returning from. Is there any kind of sharing of this information, of really critical best practices or medical practices that is making its way to support those that
Yes,
are
absolutely.
veterans?
So, so Dr. Gajar, who we recruited, actually has a number of grants from the Department of Defense and is working with the veterans. So our center will be working with veterans, professional athletes, college athletes, NCAA, and high school and community. Go ahead.
Yes.
I'm going to go to the microphone.
Is there essentially an evaluation of the physical impacts in conjunction with the cognitive performance? That means if you have a concussion and you kind of drop significantly, that's probably quite straightforward. But what happens if you get hits which are below a concussion level but which might tear at the fabric and over time accumulate? Do you have a way of transferring the physical magnitude of the hits over time and see a gradual decrease?
That's a really good question, and the short answer is no, we don't now, but we're developing that. So we've invested in some new MR scanning, some very sophisticated scans that use different sequences, and we can pick up very subtle injury, such as tiny little bruises in the brain, or changes in the fiber tracts, or ultimately we're hoping we can pick up metabolic changes that might answer the question that you're saying.
You hit on the thing that professional athletes, my friends, my brothers in arms in the NFL are most concerned about. Because we're getting a handle on episodic concussions. We just are. I mean, you can say it's not there yet, but we're getting a handle on it. But this is the thing, this is the issue that concerns these guys the most. Can I not have a concussion and still, over the years of just playing my position and running into people and doing all these things, can it cause me real damage. And that's that assumption of the risk thing. And I appreciate Gary because they're driving at the answers to these things. And I'm grateful because that's the most unnerving part, to be honest with you, for guys that are playing today or played over many, many years. Like, I mean, especially certain positions. You know, in football, I wore a red shirt throughout the summertime. No one could touch me, you know. But the guys were playing every day, just banging around. And so I was susceptible to episodic concussions, but I was not susceptible to these other things that these other guys, my cohorts, are going through. So to me, that's the place that we're driving to because that's the most immediate need that we have as players.
In some ways, that's a holy grail. I mean, it's almost like, can you pick up early signs of Alzheimer's, another disease? And now we are starting to develop tests. Maybe you can pick up a little bit of that protein developing early on. So we're working on that. Very important.
One, it's my impression that the difference between male and female concussion rates, maybe in soccer, could be the development of the cervical muscles, their responsiveness, ability to brace. Is there any validity in that? And can the athlete prepare themselves with specific cervical exercises to circumvent that? And second, a word on the soccer helmets that certainly don't prevent concussion, prevent skull fracture, but maybe causes the player to be more aggressive and exposes them.
So I'll address that first. Maybe Steve would want to have a comment. You raise a very critical point. So Dr. Gajar, who's an expert in this, thinks the problem is not so much designing a better helmet or preventing injury to the head. It is stabilizing the head with respect to the neck. And he thinks maybe what we need is a little brace between the shoulder and the head so that you don't have the rotational injury. That's the main problem. So we're working on it. I mean, right now that's not, we don't have a device, but that may be the crux, is that you connect the head to the neck with some simple device. It doesn't obstruct play.
I worry that these technologies that develop safer equipment just allows more reckless behavior.
Yeah.
So, some of the theories that you run around, you're hearing about football is just take the helmet off, and we'd really solve. I don't know if that's true, but I don't think. That would help the situation. But that's the counterintuitive part. So what Gary's driving to is things that actually prevent, no matter how reckless you want to be, injury. Not allowing you to feel. Look at race car drivers in their steel cages now. They can be so much more reckless because they're safer.
Because with racing, that's true. That's what they do. They stabilize the head to the neck. But what do you think? Isn't there something to building up the neck muscles to prevent injury?
I totally agree with that.
I think that's
like anything. I always said, people always ask me, who hits you the hardest? Who's the hardest hitter? Who's the meanest guy? And I said, it's the unblocked guy.
Yeah.
I don't care. My mother I could turn back and she could run at me full speed and hit me and knock me out. Yeah. So it's like I didn't really care who it was. Just I needed to know they were coming. And so if you can brace yourself and get your muscles engaged and if they're strong, and you've got them really, and they can protect, yes, a lot of this from engaging. But when you don't know it's coming, or you're surprised, and it's like any injury, right? If you don't know what's happening and you get hit, it doesn't take much for a knee or an ankle or a brain to move around very much if you don't know it's coming. So there's no question of having your muscles better prepared and better. And I actually don't never remember working out my cervical muscles very much. But
well, you worked out with
I'm sure that there's specific muscles to do that. Thanks, Gary. Thanks so much for the time.
How about a round of applause for these two amazing icons?
The preceding program is copyrighted by the Board of Trustees of the Leland Stanford Junior University. Please visit us at med.stanford.edu.